This is a microfocus magnification image of the right breast of this asymptomatic 41-year-old woman who had cancer between the nipple and the chest wall. Look at the posterior border. The surgeon cut through the cancer despite mastectomy. In the continuation, I'm going to show you different areas of this very typical neoduct genesis. Right now, I am outlining the cancer cells which are inside the basement membrane. Out of these cancer cells, fake fibroblasts, so-called desmoplastic reaction, is going to develop through epithelial mesenchymal transition, EMT. And then we see also the thick lymphocytic infiltration around the ducts. These are not her own pre-existing ducts. These are neoducts. They are newly formed by cancer. That's why they are so disorganized, contorted. I'm showing again in a higher magnification the cancer cells. Some of them have solid, others micropapillary tumor growth pattern. The yellow is the desmoplastic reaction, and then the blue is the very thick periductal lymphocytic infiltration. Dear colleagues, this is neoduct genesis. These are the histopathologic signs of neoduct genesis, in addition to this haphazard, disorganized structure. Isn't that strange that some pathologists call this TCIS? It is not. Here's the cross-section of another duct-like structure. Cancer cells. There is only a thin layer left because the rest has undergone necrosis. And likewise, here is the thick periductal desmoplastic reaction and an even thicker periductal lymphocytic infiltration with blue color. I'm taking away the color so you can see the original histology again. This is going to be interesting. This is not just a simple additional cross-section of a duct-like structure, but you see those circular cross-sections of cancer-filled ducts around it. Some pathologists may call them multifocality. Now, they are not. If I was drawing the longitudinal section of this duct, or duct-like structure, then imagine, by thinking in 3D, that this duct had neoduct genesis-like side branches on both sides. And when the histopathology technology slices using 4 micron, then you get a ring, which corresponds to the so-called multifocality, and another ring, and also on the other side. No, this is not multifocality. It's a contiguous tissue, the original duct in the middle, the side branches on the side, and of course all of them are filled with cancer cells. This is a demonstration of neoduct genesis. Now we understand much better what misleads the pathologist who calls it multifocal. Look at the ring-like slices on one arm and another and a fourth and so on. This is again without drawing. What is coming is really the most interesting in this presentation. Look at that long duct with no associated TDLUs. This is really a duct. And the preparations slice the duct in a way that first you see the periductal thick layer of lymphocytes. The red color outlines the cancer. The yellow, the periductal desmoplastic reaction. But then the blue color outlines the lymphocytic infiltration. All the histopathologic features of neoductgenesis are right in front of you, but we are going to magnify this duct because it's super interesting. First of all, the cancer cells in the middle. Then a very thick layer of desmoplastic reaction and lymphocytic infiltration. But this is what I wanted to share with you. Do you see that the cancer cells, from within the major lactiferous duct, break themselves through the basement membrane and form a new duct, neoduct? Let me take it away, and then you see that not only this, but beside it and beside it, there are these cross-sections and longitudinal section of neoductgenesis. Of course, the thick periductal lymphocytic infiltration follows all these. Look at the cancer cells streaming out from inside the lumen of the duct. But there are many other neoductgenesis images here, because this specimen had a large number of newly formed ducts, duct-like structures. Also, the acini were full of cancer. Wherever I touch with my pen, I see neoductgenesis. Because of this extensive nature of the disease, the MR was very positive. But now I pick up another slice of this case, and as you see right under the skin, there is neoductgenesis. When we magnify this, you see that we are talking about DAB. Here is the desmoplastic reaction and the lymphocytic infiltration. And these are abnormal duct-like structures. It's a true cancer factory. Obviously, surgeons should look at these presentations, because then they would be convinced that skin-sparing mastectomy should not be done in these diffuse cancers. And also look at the surgeon cuts through the cancer. Look at the margin. Why, when the MR already showed that it's a very extensive disease, why do they perform segmentectomy first? It's incorrect.